American Journal of Public Health. Given the big fires that are happening in Los Angeles and the huge public health disaster that has occurred, we thought with my dear co-host, Vickie Mays, who actually lives in Los Angeles, to do a short interview about the situation there, the role of public health, and also to talk about what will be the long-term consequences of this disaster. So, Vickie, always great to see you, even in those very, very hard situations. So, tell us a little bit about what you see there and the situation at UCLA where you work.
Thanks, Alfredo, for doing this because I think it's a time for us as public health persons to share what it is, because this doesn't just affect us, it affects us in a very terrible way. But there are people who are watching it, there are people who want to know what to do. And so I think having this podcast, as difficult as it is probably a good thing. So, one of the things about LA right now is you just can't fathom the consequences of what's happening. So, many of you who don't live in LA have been watching the balls of fire and how they've been moving. And then you'll see later just charred remains, what used to be a community. So right now, over 23,000 acres of the Pacific Palisades have been destroyed. In the Eaton Fire, which is where we have the oldest Black middle-class community in Los Angeles, in Altadena, over 14,000 acres have been destroyed. You can't wrap your head around that. But for those who are concerned about climate, we now have to worry if we get a lot of rain. The rain will be great in terms of putting out the fire, but we have no vegetation to hold the water. Some of us are going to be worried about if it starts raining, it's joy to us for the fire, but then it will be floods.
What's the difference between being affected by a big fire versus a flood or versus other type of natural disaster?
I've worked several natural disasters, and I will tell you that I'm of the opinion that fire is the worst. And here's why. I worked in New Orleans after Katrina, and you could walk around and see your belongings, for example. They would be wet, but you could at least see them, you could get them, you could try and dry them out. But if you look in LA right now, it's just ash. There's nothing to be saved. And for people who left with the notion of potentially I'm coming back, the amount of regret that people are experiencing right now about the things they didn't take. There was a news snippet in which a woman was trying to find the ashes of her husband, who had just died a couple of months ago. She didn't take the urn. I mean, one of the things, and I learned this from my work in New Orleans, is whoever really plans the disaster response feels so guilty afterwards, because it's like you decide to leave or you decide to stay. If you leave, well, what am I going to take? If you stay, and there's tragedy. So there's so many ways in which people have to cope with what happens in the tragedy. Also, with the fire, you know that there's going to be wind, but you don't know where anything is going to happen quite often. And with the floods, you usually get some sense, and you have just a little bit more time. In that sense, a fire is like an earthquake where you don't have a lot of time, you don't have a lot of warning. So it's one of the reasons that public health has to really step up disaster response. Public
Let's
health,
talk about this now.
yeah.
Let's talk because this is more into even though the disaster is absolutely huge and there's a lot to say about it, but tell us about the public health response in this context. Yeah.
What we've seen is people who, despite the fact that their own house may be burning, they take seriously their responsibility to be a first responder. So, very much like 9/11, we have to be vigilant about how our first responders are doing after this is over. And we have to understand that the first responders, they work tirelessly, but it's what they see. So, and it's what they couldn't do. So in LA, because we had water pressure problems, there were fire people who had to walk away from a house that's burning. And that's what you do for a living. And you know that if you had had water, you could have saved that house. So our first responders should be our first responsibility. And, it's like we always say, thank you for your service. We really have to not just thank them for their service, but we have to think about what services will they need over time and prioritize those. We learned that lesson about them from 9/11. The other thing about a public health response is we needed to go where we were needed. You could not stay within the confines of the Department of Health. So, as an example, the Department of Mental Health went to the evacuation shelters. They were helping people get their psychiatric medication. So, the one thing that's been prioritized is making sure that we don't end up with health implications because people are lacking the medications. So there's been, you don't think sometimes the pharmacists, but during this time, the pharmacists have been really important. Supply chain issues are really important to be able to get those drugs as quickly as possible. Because what we start to see is that, people are very stressed. A couple of days off of certain medications, you start to see the stress is already impacting their metabolic response. And now you have them without the medications to control or try and temper those responses. So then you're just a disaster waiting to happen in terms of needing to get people into the emergency room.
Yeah, this is my own research. I've been following first responders at the World Trade Center for
Yeah.
now more than a decade, and as you know, these were young people who entered the disaster and then cleaned what was left of the towers, and they came out. They were much older physically, and the prevalence of post-traumatic stress disorder is huge in this
Yeah.
population. It's 20-30%. And we see the long-term consequences on chronic diseases and cardiovascular diseases. So we were lucky in New York because we got the Zadroga Act. I think there should be a Zadroga Act for LA. So in order to take care of all these first responders and make sure, they have access to health care in the coming year, because that's another issue.
Oh, without a doubt. One of the things that people are very frustrated about is despite the fact that there's not an active fire, they want to go back to their homes. And one of the major reasons they're not being allowed is because of the toxins in the air. So, LA County Department of Public Health has forbidden our gardeners from using blowers right now because they keep raising the toxins and spreading them further into the air. So that's public health. Public health learned from what happened in 9/11 about the toxins. And so, it's a lot quieter on days in which gardeners are visiting because we don't realize the extent to which the toxins are laying on the grass and all these other places. So they don't want them disturbed in ways in which it just spreads.
So what's your main message you want to convey to public health people in California today?
I actually want to convey a message, not just to the public health people here, but to people in other places. And it's a lesson that I learned when I worked in New Orleans, which is people in the middle of a disaster are so appreciative when people who are at other places are thinking about them, reaching out and helping them. So if you know people here, be that place where they can talk to you. Be that person that checks on them. Be the one that can send them things so that they feel that I have a person. I have a person who says I can come stay with them, or I have a person that says I'll send you whatever you need, or I have a person that will let me be me on the phone and social media or whatever. So that's really important. We need you who are outside to be caring about us. But we have to think about the issues that I wrote in my AJPH special issue on public mental health. With a fire, which is very destructive, it destroys community. You don't know if your neighbors will come back. You have shared much, your kids are there. It's like we have to really move away somewhat quickly from just this notion of psychological first aid to individuals to thinking about community rituals, to helping people say, where's my neighbor? If I'm rebuilding, is my neighbor rebuilding? So that you have somebody who's kind of side by side with you, going through all the trouble of getting the lumber there and, you share the same architect and all of that. So part of what we don't do well is people scatter. And what we're hoping is that we will find a way to help people to be back in touch. Each time a disaster happens, we're getting better about the notion of people having other people's cell phone and knowing how to reach them on social media. So my hope is that we will also begin to think about community building, not just fortifying individuals. The individual that stands alone is more likely in the long run to be the PTSD case that you talked about. The individual who stands with others is likely to have what we call acute stress disorder, but not necessarily progress to PTSD because they're with others.
Listen, Ricky, I think this is a major public health message. And, we all feel very sorry for what's happening there and wish you and your colleagues from UCLA, all the possible courage and luck so that this thing ends and UCLA comes out not too much physically affected, but we understand the mental damage is going to be huge.
We're worried about our students, and so we're moving quickly to do something such as having meditation, mindfulness, the kinds of things to help them feel cared for, centered, and not alone, even though they're sitting here with many, many other people. So thank you, Alfredo. UCLA feels very fortunate that we weren't damaged by the fire, but we do have a lot of work to do to take care of this miniature little city that we exist in.
Thank you, Vicky. Thank you for, being who you are.
Thank you. My wonderful co-host, thank you very much.
Thank you. Take care, Vicky. Bye-bye.
Bye-bye.